Are we live? Oh,
Yeah, good afternoon.
good
Hello,
afternoon.
everybody. Thank you for joining us today for our frequent asked questions on Tuesday. Today, we have the pleasure to have our wonderful Chief Operating Officer, Susana
Yes,
Craig. Thank you so much for making us a space in your busy agenda. We know that you are always busy, so thank you so much for taking a couple of minutes to answer our questions.
my pleasure.
Thank you.
New visitor in the queue.
Well, I need to, sorry,
That's okay.
problems of life. Just let me. One of the most frequent questions from our patients are, or future patients are, what if I already have an active prescription? Can I still use your services?
Yes. That's an awesome question. So we are one of the few companies that allows you to transfer a prescription, transfer meaning move over your prescription from your pharmacy, from whatever pharmacy you have it at, directly to our pharmacy partners. The other thing too is if you've seen your doctor, you could just have your doctor send the prescription directly to our pharmacy partners as well. All that information is on the website. Now, all you need to do is go onto pandiahealth.com and say, move or transfer my prescription. Yes, I have a prescription. We just ask for your name, your telephone number, your email, of course, because we need to communicate with you, your address, because we need to ship to you. And then any other information, did you want this prescription? Are you skipping your period? And any other information that you may want to give us. And of course, we send out, our package is very discreet. Let me just show you, excuse me.
Great. Oh, that's so cool that you have them around.
Yeah. So we have a very, it just comes like this. It doesn't have this Pandia Health sign on it, but it's very simple. And so you don't have to worry about anybody knowing your business. And we also include the HIPPAs and some information.
Beautiful. All right. So what about patients that are located in other states that is not California or Florida? Will they be able to get the prescription delivered?
Yes. So if you want to transfer your prescription, you can transfer it from any state in the United States. But if you want us to write your prescription, meaning you don't have a prescription. Now, here's the thing. If you have a prescription, you need to make sure that it's not older than a year. That happens sometimes. People are like, oh yeah, I went to see my doctor 3 years ago and the prescription is at this pharmacy. Well, prescriptions expire. They have a lifetime. And so if it's expired, you need to see your doctor and get a prescription written. If your prescription expired and you live in Arizona, California, Florida, Texas, or Wyoming, we got you because we could write the prescription for you for only $20. But if it has expired and you don't live in those states, then you just simply make an appointment with your doctor and then tell them to send the prescription directly to us. This way you don't have to go to a pharmacy to pick it up.
Beautiful. So as easy as just asking your primary care provider to send your prescription to Pandia Health, reach us out, right? You can.
Yeah, you just send it to our pharmacy partners. Now, many doctors now, because of the pandemic that's happening, are also offering telemedicine services. So it is quite possible that even though your doctor may not be able to see you live, they may be able to set up a telemedicine conference and then write the prescription for you. In some cases, if your prescription just recently expired, it's all based on your doctor, how comfortable and the relationship you have with your primary, we call them primary providers. They may just extend and give you additional refills to your prescription.
Beautiful. Awesome.
Yeah.
And if you already have your refills on a local pharmacy, like you say, just let us know all the information about the local pharmacy where you are going to pick up every month your medication.
Exactly.
And we can take over that. We can take care of worrying about your refill. Yeah.
So typically what happens, just to let you know, it's really easy to move the prescription. First of all, you tell us where it is. So it's at ABC Pharmacy. You give us the address, and if you have the phone number, we call them up or we send them a fax, and we say, hey, this patient would like to start receiving free delivery from Pandia Health Pharmacy Partners. That was a tongue twister. And can you please send us up the prescription? All right. And so typically they'll go ahead and fax us the prescription, or they may ask for one pharmacist to talk to another pharmacist. So it takes at most a day. If the pharmacy is not too busy on their side. For us, it takes really fast. The minute you fill out your application, we're on it. We're calling them to confirm. And then we let you know. We keep you posted. We're like, hey, Jan, we have your prescription. Do you have insurance? And so we check on your insurance, or if it's cash, we'll tell you that your medication is this much. How would you like to pay for it? Would you like to set auto payment, or would you like us to contact you every 3 months to refill again? It's really easy.
It is. And what happened once you have the prescription?
Mm-hmm.
How's the process? What's the process like once once you have the prescription at Pandia Health?
Mm-hmm. So Pandia Health, we communicate with you various ways depending on how you want us to talk to you. The first one is we'll either send an email to you saying, hey, congratulations, we've successfully transferred or moved your prescription to our partner pharmacies. How many packs would you like? The second way is we could send you that same message via text if you give us permission, or we can also talk to you via live chat. And we have reps, we have live people. It's not a robot. We have people from 5 o'clock Pacific Standard Time to 11 o'clock Pacific Standard Time at night, Monday through Friday, and Saturdays from 9 to 9, and then Sundays, again, from 9 to 11 p.m. So we're always available for you if you need to talk to someone live. We also have direct numbers, too, which is the 650-437-1213. And for our Spanish-speaking clients, we have a Spanish line specifically for you, and that's the 650-451-7892. So we're always keeping you informed, like we're saying, hey, we got your prescription. Hey, how many packs would you like? Hey, would you like us to, here's your tracking number. Did you receive it? So we're always communicating with you.
That's so beautiful, because it's so hard nowadays, right, to get to people. You are always kind of getting automated messages, and it's like a bit cold, the relationship with it.
Yes.
You do.
Well, yeah, because isn't that the way you feel? Right? Sometimes it's it's so birth control is very personal, right? And so we want to talk to someone live and make sure that they understand, what our concerns are. We also have a patient profile, so that if you don't, if you're one of those people that doesn't like to talk to people, you could go there and say, oh, there's my tracking number. Oh, there's what my doctor wrote. I'm set. We work with you however you want. That's
great. Susana, another frequent asked question. What about if I don't have a prescription? What about if I need a new prescription? Can you still help me?
Sure, of course. So that happens a lot, right? So you may come to us and say, you know what, can you transfer my prescription from ABC Pharmacy? And then we call them and yeah, we have a prescription, no more refills, right? That's when we communicate back to you and say, oh, you know what? You do have a prescription, it's out of refills. We could either send a note to your doctor to send more refills if it's been within that time. Otherwise, if it's expired more than 6 months, we'll say we can offer you online telemedicine services, which basically means we can write a prescription for you. To do that, though, you need to be able to live in 5 states that we cover. That is Arizona, California, Florida, Texas, or Wyoming. And so if you do that, we'll go ahead and ask you to re-sign into your account, and then you'll answer some health questions like, when was your last period? Please upload your selfie and your ID. And ID can be anywhere, like your consular card. It could be your passport. It could be your student ID if you're in college. It could be your driver's license, right? And we need 2 forms of ID so that the doctor can see can see like a before and a current, right, photo. And so that's important. Of course, everything here is covered under HIPAA compliance. We make sure that all the information you give us is very secure, and we don't share it with anybody else. So anything that you send us, we keep, and we are very, very adamant about making sure that it is private. So once that information, you fill out all that information, we have our awesome patient care advisors that take a look to make sure that the form is filled out. Like there are times, when people are from a different country, they may, instead of putting weight, instead of putting pounds, they'll put kilos. If we're looking at the form and we feel that your blood pressure is a little bit too high, the doctor may request for our patient care advisors to go ahead and contact you and ask you to confirm your blood pressure. Also, if you're skipping your period, your last period may have been 2 months ago, but we will ask you again to make sure that you are skipping your period and if there's any chance to being pregnant. So we'd like to have a communication back and forth with our patients. So once you fill all that information out, if everything's current and you submit everything and pay the $20, although with the trending $5 discount, it'll only be $15, the doctor will review your form, take a look at your preferences, and then write a prescription. And then we notify you by email that the doctor has written your prescription, but to find out the name of the medication, you have to sign into your account. Because like I mentioned before, we're very cautious about your privacy, so email is not HIPAA compliant. And so we will ask you to go to your account to take a look at the name of the medication. And then based on what you selected, we'll either send one pack to a pharmacy near you and thereafter ship it for free, or we'll ship all of them for free.
Awesome.
The delivery is for free. But if you have insurance, we'll ship as many as the insurance company allows. And if you are paying cash, then you would pay for as many packs as you want. Typically, our patients will ask for 3 packs for $45 in many cases. That's, tier 1 medication, but most of them are around that price. And some like to plan ahead and buy 6 packs or even 12 to 17 packs. It's rare that you get a pack at a time just because, one, it's $20 per pack, and 2, you don't want to run out of medication, so people like to have at least 3 on hand.
Right, yeah. Always better to have some at home.
Mm-hmm. Yeah.
You never know what can happen,
Yes, like the pandemic, I don't know.
Great. So here's another question for you. Talking about the doctor's consultation fee.
Mm-hmm.
What does the consultation covers, and why is the reason that there is a fee?
Sure. Oh man, we get that question. So most people will say, hey, you know what? I have insurance. Why am I paying for the consultation fee? The thing of it is that our practice wanted to keep costs really low for our patients. And so we just thought, you know what? We're not even going to bother with insurance. We're just going to make it really inexpensive, $20. That $20 fee covers you for a year. That means, for example, let's say you try medication A, and for whatever reason it's not working for you. Maybe it upsets your stomach or I don't know what. And then you communicate this to us. You know what? I'm having some side effects. Can I try some other medication? And because you're a patient of ours, the doctor, at no additional charge, will go ahead and take a look at your review, take a look at your form, take a look at the input that you've given, and then recommend another medication, right? And so we check in on you 6 weeks in to make sure that the medication is working properly. And then we check in on you mid-year to make sure that you're okay. Because there are times that patients don't communicate to us, so we'd rather talk to you and find out, are you taking your medication on time? Is it working for you? Are there any other things that we should be aware? So you have that patient-doctor relationship. That's what the $20 is for.
Beautiful. That's pretty awesome because yeah, as a woman, I know that when you start with a new medication, it might not work the first one that you're trying. So you might need over a few until you find one that is the right for your body. And most primary care providers charge you for every time that you bring them or every time that you go and see them in person.
Right.
So, yeah.
Yeah, absolutely. And, and for some people, the first time the medication's written, it works fine. I have 3 daughters. One of them, no problem. The other one, she gets migraine headaches and she has to be really careful. So we've tried different medications. And the third one, it was just really upsetting her. And so we had to try 2 or 3, but now she's finally, because, she tried one and then, it wasn't helping with her acne. Then she tried another one and it helped her. So it just depends. The key thing is to communicate with your doctor. Let us know what's working, what's not working. It's important to develop that relationship, that to advocate for yourself. Like, you know what, this medication isn't really working that well, because there are times when some patients will say, well, I didn't want to say anything to the doctor because I didn't want to pay another $20. Like, no, we need to know. It's very important. We care about you. That's one of the reasons why this company was started, is because Dr. Yen is on this mission to make, and so are we. I mean, that's one of the reasons why I joined this company, is that Dr. Yen is on a mission to make birth control accessible, to educate yourself, so that we don't have to suffer every single month if we don't want, with our periods and with hormonal imbalance.
Right. Yeah. So it's really nice that you are mentioning this, because like you said, like there might be women that get prescribed a medication and they just stop taking it because they didn't like it and they don't feel like confident enough to say like, hey, this medication is not working well. So everybody out there that is listening or watching us, please know that on the $20 that you're gonna pay is just once a year payment. And if you have any problems at all, you can reach out our patient care advisors, and they will reach out the doctor to get you the right advice. And there is not gonna be extra fees to change your prescription at all. So,
exactly. Yeah. And it will always be a doctor that responds to your questions. And that's just something that's different between us and everyone else, is that, well, we respect other medical providers. Our doctors have at least, 15 years of experience in reproductive health. And we vet our doctors really well. If you want to know who our doctors are, you just go to our homepage and you'll find out all their experience. They come from, one of the best schools in the U.S. and the best hospitals.
Yeah, we have really good doctors, and they're all in
I'm
our
really proud of them.
Yeah, make sure everybody to check them out. Awesome. So after we have all these questions answered, I think I'm gonna move on to the next one. And you think that's okay?
Yeah, of course.
Great. So keeping on the line of a telehealth consultation, one of the other questions that lots of persons ask, lots of women out there ask us is, do I need to show my face when I have the doctor's consultation? A video call or a FaceTime thing?
Right. Yeah, no, with us, we make it super easy for you, because not all of us have a webcam. And maybe there are times when we don't want to be on the webcam. We just want that. So for us, all you need to do is fill out a form, answer the questions. We're very thorough about the questions we have. Upload 2 forms of ID. Typically, it's by law in some states that you have to be on video. But in most cases, if you fill out the form, you have your IDs set up. That's all that's required. It's really easy and simple.
Awesome. So the only requirement, it will be showing your face on the picture that you mentioned before, right?
Yes, you just upload your selfie. No filters, please. I know it's hard, but no filters, no sunglasses. I know you guys like to add the little ears. None of that. The doctor just wants to see the beautiful you and compare it to your government ID, which could be your driver's license. It could be a consular card. It could be college, a school ID. It could be your passport. But we just need 2 forms of ID for your safety.
Awesome. Only that, just that, and then you don't have to worry about showing your face or speak with anybody live. That's great. Before moving on to the next question, because I'm just gonna answer one of the questions that one of the person that is watching us, it has just, and she's asking if after being prescribed and after being on that medication 3 months, if this person is having side effects for this medication, she needs to pay again $20 for the consultation fee?
No, just like I mentioned before, the $20 consultation fee covers you for a whole year, and we want to know from you if you're having some effects, and sometimes it's even sooner than 3 months, right? It could be immediate that it's just not working out for you. So we need to know, and there's many ways that you could tell us. You could tell us by text, you could tell us by live chat, you could call us. There's different forms, however you feel comfortable, and then the doctor will take a look for your medication. Now, so that's basically it.
No doctor's charge at all if you have problems with your medication. You just free to reach us out, and then we will address. I know.
We're such a deal. I mean, even now with the $5 discount for telemedicine, I mean, it's $15. So
That's
use
correct.
the word trending.
That's right. Using the word trending, $5 discount, $15 to get you covered for a whole year.
Yeah. And we have a refer a friend program. So many of our patients love our program that they usually refer a friend. And for that, you get a $10 gift card for you and a $10 gift card for your friend. So it's all good.
All good. And if you're paying out of pocket, you can use that towards your medication, which is great, right?
No, we give you a gift card. We give you a gift card. Yeah, because, there's this, I don't know, some type of law or something where whatchamacallit, you're not able to gift people for medication, like you can't give them discounts. So it's just, so we give you gift cards. So we give you gift cards. We give you gift cards for, I forgot what company it is. I think it might be like TJ Maxx or things like that. We let you pick.
That's even greater because if you have insurance, you use $10 medication, right?
Yeah. No, you could use it to go shopping for something, like makeup or something, or shirts, or whatever,
That's cool.
We could shop virtually now.
Yeah, that's a new reality. Great. So moving forward, and one of the last questions we have in here is, will or does Pandia Health replace my primary care physician?
Well, no. We strongly believe that you should see your doctor at least once a year because there are other things that you should take care of, right? And so we're a complement to your primary doctor. And so right now, because of everything that's going on with COVID and everything, it is difficult to see your doctor because they might, in some places, birth control appointments are not considered important at this point. And so doctors are taking a look at other, like if you have different types of other ailments. But you should have a strong relationship with a doctor. Our founder is a doctor, so she recognizes the importance of having a strong relationship with your primary provider. In many cases, your primary provider will write a prescription directly to our partner pharmacies. So do not think that this visit with us is going to replace what you would see your doctor for, like a pap smear and your annual checkup, which you should have. And it's very important at an early age and a late age to have a good relationship with your primary.
All right.
I've been seeing my doctor for like 20 years.
Wow.
And she's great.
Yeah. Yeah, it's something that we can not forget. I mean,
it's important.
It is. Pandia Health give you all the facilities to get a prescription and to time in your busy life, but you still need to have that contact face to face and all those checks.
Yes, it's super important. That's such a great question because yes, I think a lot of things we could do virtually, but it's an important thing to be able to see your doctor, just to get your checkups, your blood tests, and things like that. We'd strongly encourage it. But for things like birth control, if you answer the questions, it's easy for us to write. Or if your doctor just isn't available, like in many cases, people have their primary doctor, and but they're not able to get to see them right now. And so what they'll do is they'll just use the online doctor consult to go ahead and get their birth control prescription.
Right. Yeah. As long as there is no other health concern, right?
Yes, and we will tell you. Like if you answer questions to certain things, the doctors will reach out and say, you know what, we would like you to go and see your primary first, and then after that, she could write the prescription or just send it to us.
Yeah. All right. That sounds
Safety
good.
first. Safety first.
Definitely. Awesome. And that's why, I mean, that's so important. And I think that that's really, how you say, I admire that we have doctors that are real doctors that care about our health.
Yes. Yeah, and
That's,
not only that, but with experience in reproductive health, right? So, so you should feel confident. And we list all of our doctors on our website. You'll never have to guess who our doctors are because we're right there. We want you to know, and we want you to understand that they come from one of the best schools, one of the best hospitals, because Dr. Yen takes a lot of time to vet and make sure we get the best possible care for our patients. It's so important to us. And because of that, when you come to our website, we're not going to promote one specific birth control over the other because we think that your consultation is unique to you, and we need to take a look at your whole profile to make sure that we're making the appropriate thing. So while we are a company that wants to make a profit, our primary objective is to make sure that we provide the best medication for you, not based on how much we're going to make. And that's a huge difference because if you go to other companies, they may promote a product that they may get cheaper, but may not be the best for you. And so we're the opposite. We will always look out for the benefit of our patient first. And that's because we were founded by a doctor who takes an oath to always provide the best possible care.
and because she's a woman and she knows.
Yeah, she's a woman, and that's one of the reasons why Dr. Yen started this company, right? She wanted to make sure that women had access to birth control, that it was super easy, and that it was the best possible care. That's, if you want to bring it down to that, that's our best, that's what we want to offer. And I get a lot of joy and satisfaction knowing that we offer that type of service. As I'm sure you do too.
Totally, yeah. It's beautiful to kind of help women out there and make all this a bit easier because it shouldn't be that hard, right?
Yeah, it should not be that hard.
A woman's right.
It is a woman's right, and we have to be careful of that lately. Anyway, sorry. I always get so emotional and passionate about it because, when I first met Dr. Yen and she was talking about what her mission was, I'm like, yeah, I get you. I want to make it accessible. I want to make it easy for women. We've got to empower women because who wants to bleed every month if you don't want? We're in such a great time for now at the stage where if we want to skip our period, we could skip our period. If we want to get medication delivered, get medication delivered. If we want to keep our privacy, we have privacy. We have to protect that, and we have to make it accessible as possible.
Yeah, and you're doing it, so that's awesome.
Yeah, we are doing it.
Beautiful. Last question for you, Susana. Because I know that you're super busy. This is, I think that the most asked question, the most frequent asked question is, do you offer my brand birth control pill?
Yes. Oh my gosh. We get that question frequently, right? So yes, we offer any type of medication that you want, right? And so, and most pharmacies will make that available as well. And that's really important because while some medications, you'll see that in some cases, some medications, some labels are more expensive and less profit, and some are less expensive but more profit, that some companies will promote other medications over the other. We won't do that. If you want a certain medication and you tell us, that's exactly the medication that we will send you and we'll ship out to you. So yes, we carry every brand, and we're aware of all new brands. I mean, lately, thankfully, for example, I know we've been talking about the pills, but we've seen a lot of changes. Like now there is more options for the ring, for example. There's more manufacturers for that, so we're very excited about that. There's now a new company coming out that's coming out with a different patch, because right now there's only one manufacturer for patch. It's quite expensive, so we're hoping that it'll be lower. So we will always keep aware and inform our patients of the different options, because, you know, if things were all equal and you had insurance and your body was okay with it, you know, as Dr. Yen has said, you know, for people to stay with their medication, it would be best, you know, to start with an IUD because it's the most effective. But if that doesn't work, then there's the patch, the ring, and the pill. But if you're on a budget, you know, usually pills are the best way. And then some people, you know, don't like putting a ring inside, or maybe they're swimmers and so a patch is not going to work, and the IUD isn't for everybody. So we are all about options and carrying everything possible.
Beautiful. Awesome.
Yeah.
So
yeah.
if anybody wants a specific brand name, they can just reach us out and ask for it.
Mm-hmm. So, yeah. So, you know, the other thing is that we're about education, because, you know, there are very few brand names. And so and then there's a whole bunch of generics. And then from the generics, we'd like to find out, you know, why is it just that you're more familiar with that name, or is the ingredients the most important part, which I think in many cases is the situation. There's some people in particular, for example, they may be allergic to some color, a color that's inserted in the birth control. And so they will let us know that, and then we will make sure. So when you fill out the form with us, or when you see your doctor will always ask you, do you want a brand, or would you accept generics, right? And so based on that, we will go ahead and say, okay, she's accepting generics, and these are the types that we could send out. But if there's a specific brand, then the doctor will write what's called dispense as written, meaning that only that medication, you should only get that medication. So if that's the case, if you're like adamant about having a very specific medication, you need to let us know. Now, if you have insurance, just know that your insurance company may not like that. They may say, you know what, is there a medical reason why you only want this medication? And so that's, in many cases, that might require prior approval, which a doctor needs to fill out. And then the insurance company needs to decide whether or not they want to, if they're going to approve that or not. If in cash, if you're paying out of pocket, it's not really a problem, but it could be, you know, brand medication is usually more expensive than generics. But we will talk to you about all of that.
Right. Yeah. You will always give the options, and
So we always give. Sometimes we give too many options, but we do talk it out. You know, again, we have the ways of live chat, calling us, emailing us, and texting us so that we make the right so that you pick the right solution for you.
Beautiful. Right. Always based on the contact, right? Communication, the first thing for us. The first thing is women's health care. We need to base on our good communication. Awesome. Susana, thank you so much again for all our questions today. And just to sum up for everybody, if you have a prescription, please reach us out. We will help you to skip the trip to the pharmacy, offering you free delivery service with free goodies. We will take care of your refills. You don't have to worry about anything.
Sorry, something dropped.
And if you need any prescription, please know that we have professionals that can help you to get a new prescription within 24 hours from the comfort of your sofa, bed, wherever you are with Wi-Fi and your phone. And please use the word Trendy, that is right on the bottom, to get $100 discount. You will get a new prescription valid for 1 year, $15. This is such a deal. Plus,
yes, it is. It's a bargain, man.
Yeah, it is. So thank you so much again, Susana. Thank you, everybody out there watching us. Please join us every Tuesday where you can ask questions with Dr. Jen. And have a good evening.
Yes, have a great night. Bye.